Smashers, guess what? Another Smash day, right? We're going to be doing ankle mobility, right? Because you guys all send me these messages about ankle mobility, and I love it. Keep sending me stuff. I'll do my best to catch up to them. There's a lot of you guys, so I'm trying to get everything caught up as best as I can. I know some of you guys have, you send me messages going, hey, Trev, where's my video? I'm doing my best, trust me. So what we're talking about is ankle mobility. The ankle is 26 bones, about 30 joints, you know, give or take a little bit more. And what happens is the ankle has to adapt, the foot has to adapt to the terrain you're standing on. But the problem is that when you're moving, gravity's relentless, right? Never stops, but your body's variable. So the more you move around, the more that foot has to adapt 20, 30, 40,000 times a day, depending on what you're doing and the level of intensity your activity is. But the problem is when that ankle doesn't move, the hip gets beat up, and then the hip gets beat up, the knee suffers the most. So that knee, simple hinge joint, don't get crazy with it. It's a simple hinge joint with a super tiny little movement at the end called the screw home mechanism, but we don't need to get into all that. The problem is when that ankle doesn't work, it binds up. So let me show you what happens. And I got two funky drills to do for this. They're gonna seem so easy. They work every time. So what you do, first of all, is when we look at the ankle, you're right, I'm in socks because I want you to be able to see that. But the ankle, so if you look at it, my heel is planted on the ground, and I should be able to pitch all the way forward, keep my heel glued to the ground. My knee should be able to, I'm not saying lift like this, but it should be able to travel past my toe. If you come to this point and you bottom out, and then you wind up doing this, your ankle mobility, super stinky, man, it sucks. So, and that's a medical term, you can use that. But what happens is a lot of times that talus here, there's a dome, a dome of a bone basically. It's a bone that's shaped like a dome, right? We can do this all day, back and forth. But it sits in between the tib and the fib, and it rocks back and forth. And when you bring your foot or your knee forward like this and that heel stays on the ground, what happens is it tucks backwards. And if it can't tuck backwards and it rams into the bottom of the tibia and the fibula, it picks up the foot like this. So you wind up squatting two ways. One, you wind up squatting and you dump your knees inwards to get slack. So your squat, instead of having nice wide toes forward, instead of being able to squat the way you're supposed to, you wind up squatting. I don't even know if I can do it. You wind up squatting like this. So you see what happens is I'm trying to feed slack into the system by caving my knees in, and I wind up rounding out my shoulders, and the hip gets beat up, but the knee, that MCL and that medial meniscus just gets chewed up like you threw it in a blender. So what we're gonna do first is I'm gonna get into the bottom of a squat and show you some really funky stuff to do. Super easy, but you wanna do a bandit squat. So step into the squat, or step into the band, loop it around your butt. Good, so you can see me here. I kind of got a bad camera angle, but that's all right. So I'm gonna load up the band. So I'm here, it's around the top of my glutes, okay? All I'm gonna do is I'm gonna sink into the squat. I want your feet a little wider than a normal squat would be, so a little wider than shoulders. Come out about 5 degrees, and then just sink in and let the band do the work. So now I'm comfortable in the squat, I don't have to worry about supporting myself. Now what I'm gonna do is I'm gonna rock forward. Now if I rock forward, my feet twist out, that means my ankle mobility, my hip mobility is a little questionable. So what I want you to do is you're gonna force your feet to stay straight, keep your chest really tall, squat like a gorilla, or like Kyle over there who's got a really killer squat. I'm gonna go ass to grass, and we're gonna take this and we're gonna ride it forward. You can see my knee is coming out past my toe. Okay, in this instance, not for a lift, okay? You're gonna drop in here, and then you're just gonna sit here and hang out. How long? 2 minutes. I had one of you guys send me the best message. I asked how long, you guys told me you yelled 2 minutes at my video, which I think is hilarious. So you're just gonna hang out here. That's gonna force this into a good position. I want you to screw those feet into the ground, so like you're trying to spread that floor torque it apart. This is gonna help keep that ankle in the right position. If your toes come up like this, adjust your position. The band is gonna do the work. So I can hang out here all day. The band is gonna do the work. That's the important part, okay? You're just gonna hang out like this, 2 minutes. That's number one. When you're done, come out of it. Oh, this is super uncomfortable. Good. That's hip mobility on Trev's case. Number two is we're gonna get that talus to tuck, and then we're gonna go back and check it. That's where it's cool. So you can retrain and get this bone to work the way it's supposed to just by stepping into a band. So I'm gonna have it looped around so you can see. Looped around the anterior portion of the ankle, loaded up. Like, I mean, yeah, let me move this camera. I'll just do this. Super fun, huh? All you're seeing is like my torso, my feet. Super retarded. So we're gonna go like this. I'm just gonna push forward on the band. I'm using a lighter band. Use a heavier band. I'm just doing this because I didn't grab a lighter one. It's the only reason. So you guys asked me about my band. Heavier band than this. Load it up. Push the knee out. So the tendency is gonna be that for that knee to cave in. I want you to take that knee, push it out, keep that foot planted on the ground, and then scour around and just hunt around while this heel is glued to the ground. So I'm gonna aim towards you and you can see what I'm doing. So I'm gonna load up the band. Yeah, I'm still here. Don't worry, Smash Gang. I ain't going anywhere. I'm not gonna leave you. So I'm gonna load this up. My heel is planted on the ground. This band is loaded up, dragging the talus backwards. Now you see how the knee wants to automatically cave in like this because my hip mobility is a little bit funky right now. So what you wanna do is you wanna push it out. So this is gonna stay here, heel's glued to the ground, band is dragging you back with about 2,000 pounds of force, and then you're just gonna push it out. And you're gonna scour around and just reset that talus until it does what it's supposed to do. Oh, this is grisly. And then really, like you can always give your knee a hug and really push that into position. That'll force this back to where it's supposed to be. Mechanics of the foot work the way they're supposed to be. Next thing you know, your squat, toes forward, right? Drop into the squat, and you can see how much lower this side is than this side? And I didn't even do much except for a couple of things real fast just on a demo. I didn't even do it for the regulated required 2 minutes in the Smash world. Hey, listen, that's how you get your ankle freed up in a super cool way, super easy way. I'm Trev, SmashweRx. Have an awesome day. I'll see you guys tomorrow.